Hello, everybody. We're going to be looking at two chapters for our lab coming up this week. Two chapters, the immobility chapter, chapter 28, and then also we're going to be looking at the activity chapter. It's actually activity and exercise on chapter 39. So I'm going to start out here with maybe just kind of an intro to both, and then I'm going to actually start with chapter 39 first. So I'll kind of let you know again where I am for this podcast. I don't have slides specifically to go with this podcast, so make sure that you just take notes on a sheet of paper or on your computer. However, on Moodle, there is a sheet uploaded that you can utilize for, and I'll tell you when we get to that point. It's positive effects of mobility and negative effects of immobility. So I'll let you know when we'll utilize those sheets for your note taking. It's optional, I guess, if you want to use it or not. It is just kind of maybe an easy way to organize your information if you want to use that sheet. But first, when we really think about this lab, activity, exercise, and immobility, it's really important that in order to do any activity that we have to be mobile. We have to have that mobility. So really mobility, the definition is really the ability to gauge an activity or free movement. So if I want to get a glass of water, I can move to get a glass of water. That's just an example, but mobility is really needed in order to do any activity or activities of daily living, which is a term that we'll use a lot, ADLs, really in general for all of us and our patients that we take care of. There are a lot of benefits body-wise to the mobility rather than even just the stuff that we think of, but mobility really assists our body systems to function properly. So when we think of things like our respiratory system, our GI system, our bowel system, urinary, cardiac, all of those things really depend on us being able to move. And if we aren't able to move, and we'll kind of talk about that with that handout here pretty soon, it really restricts some of those body systems and they don't function as well as they should. Moving or that mobility, being active, also really helps build up our muscle tone and then increases our energy level. So it's kind of one of those things where one thing leads to the next. And really, when we think about it, mobility promotes a lot of freedom and it promotes a lot of independence. So when you take care of our patients in the hospital, a lot of times their mobility might be restricted. And so it takes away that freedom and that independence that they long for, that they're used to. And so sometimes we also then really have to look at another, if we want to think about it as a body system, our psychological system or our mind. Sometimes if patients are unable to move like they once were, they might be depressed. And so those are things that we always have to watch out for or assess for. Within that, body alignment is also really important to mobility and activity and exercise. So when we talk about body alignment, we really refer to the position of the body parts in relationship to each other. So when we think of someone with a good posture, really is everything aligned? And that's really what we're looking at. And we really have to figure out what is having good posture or what is having proper body alignment. I'm actually going to have you turn to page 798 in your book. You'll see on the top of that page there's a graphic of a guy. He's kind of a two-angled guy there. And essentially what they're showing is that correct body alignment when standing. And if you, again, if you didn't hear me, it's on page 798. It's actually figure 39-8. When we look at that guy, you can really see there's an X kind of in the middle of the body there. It's called the center of gravity. And it's really at that center point where if you think about the whole mass or that weight or that mass of your body is located, that's kind of really where that support, it really gives that support to your foundation. So good body alignment does a lot of things. It promotes balance when we're walking, when we're standing, sitting, etc. It reduces strain and injury, helps with breathing, and increases GI function. So when you think about, maybe some of you were in choir once, and did they ever make you sit up straight or stand up when you were going to sing? Because that helps get your lungs, and that good body support helps your breathing. I also think of somebody with good posture just even by the look of it. If you see somebody with, sitting there or standing there very, if you want to say firm or very solidly, you really kind of think, wow, they're really healthy, or they're really strong, or they even mentally are very strong and confident in who they are. When you think about somebody that has a poor posture, that might slouch in their chair or sitting looking down, or kind of have their shoulders slumped over, we may not actually perceive even mentally the same thing, that they might have low self-esteem or poor confidence. So it's interesting how even just looking at somebody's body alignment, looking at somebody's posture, can kind of give us an indication of maybe how they're feeling, who they are as a person, a lot of different things there. So I'm specifically actually going to move into chapter 39, which again is on page 787. So we're backtracking a little bit here. But that's the start of chapter 39, activity and exercise. So we talked a little bit already about the correct body alignment when standing, and really a lot of that proper alignment allows for us to be comfortable. It prevents having contractures. If you're not familiar with what contractures are, I can probably show you in lab better, but they're where your bones and where your ligaments will kind of pull maybe your extremities into a specific, they kind of pull them tighter. The ligaments will pull tighter, and actually they won't be able to use that extremity as well. Proper alignment also promotes circulation. If that blood flow isn't impeded, it helps to promote that blood flow. There's also less stress on the muscles, tendon, nerves, and joints, because they're sitting how they were developed to sit. They're sitting in that proper alignment. They're not having to stretch or strain. And then lastly, prevention of foot drop. We'll talk about foot drop, and remind me to show you in lab. But after a person is immobile for a longer period of time, they'll actually get where they'll be laying in bed and their foot will just drop. And they'll actually kind of look like they have, if you think about the ballet person with the pointed toes, except for they won't be able to then pick their leg up into that proper alignment position anymore. It will stay like that. So that's something that we want to prevent if people are in beds for a long period of time. We do need muscle tone and good bone strength also for proper posture and proper alignment. When we think about muscle tone, we might think of tone as that normal state of tension in the muscle, kind of that equal distribution, so it's not pulling one way or the other. Sometimes we use different terms that you'll want to be familiar with to describe muscle tone, and they're kind of what we would call abnormal. The first one is hypotonicity. I'm going to spell it for you. Hypo, H-Y-P-O, and then tone, T-O-N, except for an I, C-I-T-Y. So H-Y-P-O-T-O-N-I-C-I-T-Y. And hypo, if you think of low, and then tonicity, the tone of the muscle, so it's a decreased muscle tone. So think of hypo, decreased muscle tone. So that muscle tone, that muscle might be weak. It's not working as well. Sometimes we also, more specifically, might use the word flaccid, F-L-A-C-C-I-D. Flaccid is a term when that joint or that area is not working at all. So somebody that has a stroke impairs their feeling and their muscle tone on that one side, their nerves, and so they may be flaccid. They may not be able to move their arm at all, or they might be flaccid in their leg. They aren't able to move that leg at all. On the other side of that is spasticity, and that's spelled Spasticity. So if you've ever heard of somebody being spastic, they're really excited or kind of crazy. Well, spasticity then is increased muscle tone. So our muscle tone might be extremely tight, and actually that can cause lack of mobility in that respect. So I talked a little bit with the example of the stroke of how nerves and muscles have to work together. And so when we really think about mobility, it takes our musculoskeletal system, so our system that works all of our muscles, and it also takes our nervous system to create that mobility. They work together. So the nerves in the muscles are sending signals to the brain, and they send them back via like our spinal cord and those types of things to tell us how to move or how to whether the muscle needs to contract or relax. Activity and exercise then are really important for a lot of reasons when we talk about mobility. When we take care of our patients, if you could turn to page 798, figure 39-5 talks about the effects of exercise. And we'll look at that a little bit more on that handout that I gave to you earlier, just a few minutes further in this lecture. But there's a lot of different things that we can do to incorporate maybe exercise into our life or into our patient's life, maybe even in their daily routine. So even things like doing the laundry, making their bed, ironing, washing dishes, washing windows, vacuuming, folding clothes. I just listed stuff that you might do around your house every day, but for even somebody out of the hospital, somebody who doesn't have as good of mobility, these could be things that at least gets their muscles moving. It helps move those extremities, and that might be very taxing for somebody who's about ready to go home from the hospital, who's been sitting in a bed for a long period of time and has lost a lot of that muscle tone and who are just weak. Some of the things regarding, incorporating exercise into their daily routine is we really want to make sure that they're doing it safely. So things like bending their legs instead of putting that stress on their back if they're moving something heavy. Maybe alternate their cleaning schedule. Some of the activities that I listed that they might do every day or around the house. Maybe one, they really use their arms a lot. So maybe wait a little bit till you do another activity with their arms and maybe do something that takes more of a leg muscle. So they don't get, it kind of prevents maybe using that same muscle all the time. And it can kind of work maybe smaller groups of muscle at a time. One of the biggest ways that while a patient's in some type of a healthcare facility, or even not necessarily in a healthcare facility, but if they're at home and they are very weak and we want to increase their muscle tone, and even just prevent it from getting worse, we can do something that's called passive or active range of motion. So ROM is how you'll see it abbreviated at times or most of the time, and it stands for range of motion. So there's two types of range of motion. There's passive range and there's active range. So passive range of motion is more of we'll do it for them. So I might take their leg and move it for them and do exercises that way. Active range of motion is more when the patient can do more themselves. So it's more exercises that we might guide them in regards to showing them how to do it, but they can actually, their muscle tone is good enough that they can perform it themselves. When you get to lab, we will actually do this and practice this. We're going to watch a video on it. So we'll do it all together, and then hopefully you can understand those terms a little bit more for charting purposes and those types of things. I'm going to actually move next into chapter 47, or actually, sorry, chapter 28, immobility. And in chapter 28, we're looking at a couple of different things. The first thing I really want to look at is body mechanics. So when we talk about body mechanics, we're really referring to how our body is positioned when we're doing things like lifting properly. Um, a lot of these procedures are in that yellow part at the end of your chapter. What I would suggest is making sure that you've looked through that before coming to lab, but that at that time in lab, we're going to have time to practice a lot of those things hands-on. So we'll go over all of those in lab. The second thing I want to just mention is body alignment. We've talked about that earlier. Making sure specifically, and we'll go through these and kind of practice them in lab, but specifically on page 417, it specifically talks about body alignment. And it even specifically, or more specifically, talks about standing, sitting, and lying down in regard to body alignment. So we'll look at that a little bit more in class, also when we get to lab. There are a lot of assistive devices that we can use as nurses to help us or help our patients maintain proper alignment, such as a footboard. There's hand wrist splints. There's some called trochanter rolls. So we'll look at some of those examples also in lab and look at how that they can be used, or even just a pillow, how the pillows can be used to help with body positioning and proper alignment when our patients are in bed. The next portion of the podcast is where you might want to either pull up on your computer there's a upload that I had in under this lab in Moodle, or you can print it out, or if you don't want to use it, I guess that's up to you, but making sure that you take notes on it. So what we're going to look at is really the physiological effects of mobility. Positively would be the mobility, and negatively would be the immobility. If you're following along in your book, this is on between page 418 and 420 in your reading. So the first system, we're going to kind of go system by system, but the first one we're going to look at is the neurologic system. So when we think about the neurologic system, we might think about the patient's mental status, how with it they are, and some of the positive things that we're going to think about first. So the positives of mobility regarding our neurological system. So activity energizes us. It gives us, just gives us that energy. And it also helps to reduce stress. You'll hear a lot of studies or read studies in research regarding how people who might use athletics or exercise as a stress reducer. And I think really it gives us an overall sense of well-being. If we're able to move, position ourselves how we like to, get around how we like to, we're going to be in a much more better mental place than if we're very restricted that way. I think about sometimes even where maybe I know one time a long time ago I didn't have my car for a couple of days, and how restricted I felt because I had to stay put and I wasn't used to that. And so just even thinking about the little things about being restrictive. Negative effects on the neurological related to mobility and immobility. So when we're not active or when we have some type of inactivity, it really kind of just decreases our cognitive function, and a lot of times our self-esteem is affected. We feel very helpless. And when we think about patients that we take care of, we want to think about these things, how that affects them, not only not being able to maybe do the task at hand regarding their immobility, but how does it affect even just their mind or their neurological status? So we can take, for example, an elderly man. He may have a fear of falls and pain, and we see this in the inactivity because it actually also decreases his senses, like his vision, fatigue, and weaknesses. So maybe he doesn't smell like he used to, or his vision is poor. He's tired all the time. He's weak. Because he has all these problems, he's fearing being, falling or having lots of pain. and that causes him he might as well just stay put because he doesn't want to risk getting hurt. So it changes that mental status. The second one I want to look at is the cardiovascular effects. So some of the positiveness regarding mobility, regarding cardiovascular, so we think of our heart, is if we're moving around and we're pumping that blood through our heart muscle is going to be more efficient. It's going to work more properly. And as it's more efficient, we decrease our heart rate, we decrease our blood pressure. So the heart is working better. It doesn't have to work as hard. And activity also increases our oxygen supply to our heart, which has good benefits. All the oxygen that needs to go to our muscles in order to provide nutrients to it. And so the more oxygen and stuff that we can bring there will really help it in the long run. Some of the negative effects, if a person has immobility, it can affect the heart in a multitude of ways. It makes the heart work harder. So again, just think of the opposite. It makes the heart work harder because the heart, that blood flow isn't being pushed through by the muscles because of that activity. So the heart is having to pump harder to get it throughout the body. And sometimes when the heart, sometimes it gets tired and it just can't push it as well, what we end up with is called venous stasis. So the blood just kind of sits or pools in a lot of times our extremity. That's why maybe in elderly people, if you've ever seen somebody who has a lot of what we call edema or extra fluid in their ankles, that kind of sits there because of the lack of muscles that they have helping pushing that blood up, back up to the heart. And that really can be life-threatening because if that venous stasis just occurs and that blood just sits there, it can actually increase risk for things like a blood clot. There's a lot of different things regarding calcium circulation. If we're not utilizing our bones and putting pressure on our bones, our bones will actually release excess calcium, or calcium, they'll just release it because we're not utilizing it. And actually, it can actually cause damage. Excess calcium in our veins can actually cause damage to the lining of our veins. Another one is what we call, you'll probably learn it in physical assessment or health assessment if you haven't yet, but called orthostatic hypotension. And when we do position changes that we're not used to, our blood pressure can drop due to those position changes. And so that's something that we always have to assess in our patients who haven't moved a while or who may have been on bed rest for a longer period of time. The third one that we're going to look at, the category, is the respiratory system. And so when we're able to move and have that mobility, we have increased oxygen intake. Whether we're running or walking, we can breathe in that oxygen and increase our lung expansion. So we can breathe in, we can take more oxygen and deliver it to the tissues. When we get that oxygen and the movement of the respiratory or the lungs, we get that lung expansion, it decreases our risk for secretions pooling in the bottom of our lungs. And when we have secretions that start to pool in the bottom of the lungs, we start thinking of things like pneumonia or atelectasis. And you'll hear that in patients. You'll hear it when you listen to them in health assessment. You'll hear that crackling in the base of their lungs because that water is just sitting in there. It's not getting mobilized and getting taken out of there. Then the negatives would just be the opposite. So if respiratory stasis, if they're not using their lungs and their muscles appropriately, they're going to be at increased risk for things like pneumonia. They're not moving their chest in and out, so they're going to have decreased chest expansion. And really that alters the amount of oxygen that they can bring into the body and the amount of carbon dioxide as a waste product that they can exit out of the body. The next one that I want to hit on is the musculoskeletal. So we talked a little bit earlier about how the musculoskeletal system really is our skeletal and muscle system of our body. And mobility really is a positive effect because that activity makes our muscles and our bones stronger. It also can increase that range of motion. We talked about range of motion earlier, but the more I'm able to move it, a lot of times the more flexibility, etc., that I'll have. Weight bearing exercises are also good to decrease the risk of osteoporosis. So earlier in the cardiac, I talked about how if we didn't utilize our bones and put that pressure on them, they lose calcium. And we don't want them to lose calcium because we want them to stay strong. That calcium helps build those strong bones. The negative effects, if we have immobility for the musculoskeletal system, really inactivity causes a lot of impairments, and it actually causes our muscles to shrink. Sometimes we call that muscular atrophy. Muscular atrophy. Atrophy is atrophy. It can cause us a lot of fatigue, decreased strength, stiffness, contractures, and again, that loss of calcium. I always think that this is kind of crazy, but if a patient has been in the hospital for 2 to 3 days, so think that's not necessarily that long. If they haven't been active and they've had to sit there or lay there for 2 to 3 days, demineralization, so taking that calcium out of the bone, actually occurs. And already they're at a higher risk for fractures and other calcium issues otherwhere in the body. If you flip over to the kind of the second half of that sheet, then the digestive effects. The more we move, the more mobile we are. We have an increased appetite, increased thirst, which increases our metabolism. So it helps to get rid of that excess fat and those excess calories that we need. Some of the negative effects is if we're not mobile, sometimes we have a decreased appetite, which sometimes in regards to what's going on, we need to have proper nutrition in order to fuel our body to help it get better in other ways. Another factor that occurs with that decreased appetite is a lot of times a lack of social interaction because with other people, they're unable to sit very well depending on their positional, and they just don't interact well with others, which can lead to other problems. Second to last is the elimination effects. Positive, when we talk about elimination, we talk a lot about bowel and also urine. So when we're mobile, you're a lot more apt to have more regular bowel movements. It enhances elimination because what it does is that activity increases the movement of our intestines, or increases peristalsis, if you're familiar with that word. Because the muscles are stronger, that waste can be eliminated more frequently. When somebody's inactive, then regarding the negative part of the elimination effects, inactivity, a lot of the people that are maybe more inactive actually causes them more constipation. They feel very bloated, decreased activity level. They struggle even in the hospital when they are constipated. Then we're bugging them. They have lack of privacy. They can't sit upright, improper diet, inadequate fluids. All of these things can contribute to bowel constipation and problems that we need to monitor as negative effects of immobility. The last one I want to hit on this is the integumentary effects. So integumentary, if you're not familiar with, is skin. And really, mobility helps us to promote circulation. The more that we're moving around, our circulation, the blood is going through our body, and that promotes good oxygen, brings those oxygen to those tissues and then to the skin. And so our skin, our hair, the color of our skin is able to maintain what it's supposed to be. Inactivity causes the integumentary system. We can, if somebody's in bed for a long period of time, they're going to be at risk for things like pressure ulcers, breakdowns of their skin because they're rubbing or they have friction against the sheet or the bed that they're having to lay on all the time, increased amount of pressure. And that really increases, especially if they're incontinent of urine and feces. And we'll talk a little bit more about that in the urine and bowel chapter 2. Decreased nutrition also contributes to skin problems, decreased healing. So there's a lot of issues that go with decreased mobility. This is the end of what I'm going to podcast as your as your ticket into lab. Make sure, again, before you come to lab that you've read these 2 chapters. Again, chapter 28 on immobility and chapter 39 on activity and exercise. There is a lot more in those chapters that I didn't specifically cover in this podcast. We will be going more into more depth in lab. We'll do a lot of positioning on how to move people, transfer techniques, those types of things. We'll also be working with proper technique or proper use of things like crutches, canes, walkers, those types of things, and learning different steps and ways to educate our patient. So those are some of the things that we're going to be doing in lab. Again, making sure that you come to lab with your notes, that you're able to show me those, and then also making sure that you've read those chapters in your book, again, chapter 28 and chapter 39. Thank you so much, and see you in lab.